Hello, let us review home hemodialysis access options. As the sole responsibility of frequent cannulation and connecting to the home hemodialysis machine relies on the patient, it is important to consider the patient's individualized choice for home hemodialysis access. Ideal vascular access for home hemodialysis should be easy to use and free from complication. The access options include arteriovenous fistula, arteriovenous graft, or tunneled hemodialysis catheter. The best choice of these three options is the mature AV fistula because of its best patency and lower infection rates. The downside of an AV fistula is sometimes it can fail to mature, requiring further interventions. On the other hand, AV grafts are often used when veins are either too small or not suitable for an AV creation. However, AV grafts are more prone to thrombosis and infection. Tunneled hemodialysis catheters are least favorable among these as they are associated with higher rates of thrombosis and infection. Before a patient performs self-cannulation of an AV access, it is important to ensure they have received adequate hands-on training and a good assessment of fistula has been performed to evaluate access length. Patients are encouraged to use prescription lenses or a magnifying glass if required for vision purposes. Use of head-mounted lighting is recommended for patients that do the dialysis and cannulation without any support at home. The technique is reviewed carefully with the patient by a dedicated trained nurse, and ongoing support is provided by hemodialysis unit. There are three techniques for cannulation of AV fistula. First is the rotating sites, or ladder technique. Rope ladder technique is recommended technique of choice. The needling site is altered along the length of an AV fistula, resulting in the formation of minimal scar tissue. The next technique is constant site or buttonhole technique. It uses the same site, angle, depth, and direction of needle repeatedly. Initially, sharp needles are used to form a tract of scar tissue to enter. Over time, once a tract is formed, the scab over repetitive needle insertion site is removed and blunt needles can be used. The third technique is area cannulation, which is not recommended as repeated cannulation in the same general area because it makes the area prone to aneurysm formation and life-threatening bleeding. For an AV fistula, rope ladder is preferred depending on fistula characteristics, or else buttonhole is used. For AV graft, only rope ladder is recommended. Rope ladder is often the recommended cannulation technique, unless AV fistula is deep, short, tortuous, has short usable segments, is difficult to cannulate, or as per patient's preference, especially if they have a fear of cannulation that cannot be overcome. In these situations, buttonhole technique can be used. The rope ladder technique requires accurate cannulation with a sharp needle, but is associated with lesser risk of infection. Buttonhole cannulation, on the other hand, is easy to perform and uses blunt needles, but is associated with higher risk of local and systemic infections. Buttonhole technique should not be used if patient has hand tremors or poor vision, as it can lead to multiple tracts formation. It is also not recommended in patients with history of prior AVF infection or who are at increased risk of bacteremia, like history of mechanical heart valve or bioprosthesis. If buttonhole cannulation is used, it is recommended to use topical antibiotic ointment at the site once hemostasis is achieved. Coming on to tunneled hemodialysis catheter as home hemodialysis access. Tunneled catheters are often used during periods of AV access complication for continuation of hemodialysis, if AV access is not feasible logistically or per patient preference after informed discussion. The site of choice for tunneled hemodialysis catheter insertion is usually the internal jugular vein. Other sites like subclavian vein and femoral vein are avoided as they are associated with high incidence of central vein stenosis and infection respectively. In summary, it is important to individualize the home hemodialysis access option and maintain aseptic precautions at all times. We have completed module on home hemodialysis access.